The connection between BMI and your health. We have all heard the adage, you can never be too thin. While that is not totally correct, as being severely underweight causes problems, the problems of being overweight or especially obese are more numerous and most often more serious. According to MayoClinic.org, obesity is a many-faceted disease and is characterized by excessive body fat. Obesity is a cosmetic concern, as we don't want to appear overweight, but even more so, it is a medical problem that increases the risk of such health problems as heart disease, diabetes, high blood pressure, and certain cancers. Why people are overweight. Being overweight is becoming a national problem in the United States. According to CDC.gov, in a study released in 2020, obesity in the nation was 41.9% of the population. The Mayo Clinic study listed several reasons for obesity: heredity, physiological factors, environment, diet, physical activity and exercise choices. Symptoms of being overweight or obese. One tool often used to determine the excess weight and obesity is the body mass index, BMI. You can calculate your BMI by multiplying your weight in pounds by 703 and dividing by your height in inches. You then divide the answer again by your height in inches. The answer is your BMI. BMI guidelines. BMI below 18 underweight. BMI 18.5 24.9 normal. BMI 25 to 29.9 overweight. BMI-30 and higher obesity. For most people, a reasonable estimate of body fat is shown by BMI. For some people, BMI does not give a true estimate of body fat. With athletes, even those with no body fat, BMI calculation may show in the obesity classification. This is because muscle weighs more than fat. Another method used by doctors to guide treatments for obesity is a person's waist size. A man with a waist circumference of 40 inches or more and a woman with a waist measurement of 35 or more are considered in the danger group for weight-related health problems. Things BMI doesn't tell you. According to an article released by WebMD.com on February 22, 2022, BMI may not be the best indicator of obesity and being overweight. For 90% to 95% of the population, it may be fine as a measure of obesity. There are critics of this idea though. One is Scott Kahan, who is the director of the National Center for Weight and Wellness. He states that defining obesity by a point score on the BMI scale and judging a person only by their size is old-fashioned and is no longer very useful. At his center, BMI is used as a starting point. He sees people who are overweight but otherwise healthy. These people are heavy, and their BMI puts them in the obese category. All other health screening shows them to be healthy. Blood pressure is normal, blood sugar is good, and they don't seem to have any health problems that are caused by their excessive weight. Other factors to consider. Muscle structure. Muscle tissue pushes up weight. An example is the football player whose weight pushes him into the obese category, yet he has low body fat. Activity level. Someone who has a low activity level may fall into the normal range yet have lots of body fat. Many elderly people fall into this group. Your body shape. An apple shape with the body fat settling around the waist instead of hips increases the risk of heart disease and type 2 diabetes. Age. Older people should have a little more fat on them, but not be obese. Ethnicity. Asians are in the normal range from 18.5 to 23.9 on the BMI scale. A BMI of 27 or higher is considered obese. If you are concerned about your weight, you should see your family doctor for weight control methods. Thanks for watching.